Hello, my name is William Weigel, and I am seeking admission to the NYU Economics PhD program. I hope to pursue a career conducting academic research in applied microeconomics, focusing on health and history. My research experience and success in advanced coursework signal my capacity to succeed in this. Beginning with my economics coursework, as an undergraduate at UCLA, I excelled in the PhD microeconomic theory sequence as well as in rigorous undergraduate courses in econometrics. I have similarly succeeded in numerous second year field courses during my predoc at Stanford. In addition to economics coursework, I have also done well in many mathematics courses, most notably in real analysis optimization and stochastic processes. As such, I am confident I possess the technical skills necessary to succeed in graduate coursework. More importantly, I have consistently engaged in the production of economic research for the last 3 years. I was a research assistant to Professor Adriana Yersmuni for most of my last 2 years as an undergraduate, working on many different papers in health economics. Most substantively was a paper I co authored in which we document that federal World War II contracts increased the longevity of black men, but not of white men, with similar though less robust results for women. Since graduating, I have worked as a predoc for Professor Dan Kessler on various papers in health policy and corporate governance. One paper I co author documents that hospitals with a CEO on the board of trustees have higher operating margins, prices, and quality of care with less service to disadvantaged populations. Another paper I'm writing with him documents how trustees of private universities have become much more left wing since 1990 relative to Gen Pop, while the trustees of public universities have remained centrist. Recently, in addition to my RA work, I have independently pursued research into the health effects of redlining maps drawn by the Homeowners Loan Corporation during the 1930s. I digitized mortality data to produce the first causal estimates of the health effects of maps, finding that they increased all cause and fetal mortality rates in the long run, but not in the short run. This work has expanded my interests into economic history and health economics. As a part of my recent work, I have been constructing a novel panel of hospitals in the first half of the 20th century that allows for an empirical investigation of how effective medical care has been at improving health outcomes historically. Using variation in both the quantity and type of hospital resources available in different cities, I intend to estimate how hospital resources effective mortality rates attributable to different illnesses throughout the 20th century. The cause specific mortality rates also allow for an analysis of how different kinds of medical innovation that affect specific causes of death have affected health outcomes historically and the efficacy of hospitals in treating different illnesses. I would also be interested in joining this data with family search longevity records that I have used in previous work to attempt to identify heterogeneous effects across different demographics. Ultimately, I want to pursue a career as an academic research economist. Thank you for considering my application.